Dr. Bayo, great to see you. You say parents should prepare their kids. You simplify this for a so-called health handoff. What's on that checklist?
Yes, I call it the health handoff. Often, as parents, we are really worried about their safety, trying to make sure that dorm room looks great. Well, as a physician, this is what I'm worried about, your child's health. And so, making sure that your child knows their health history, specifically, what are they allergic to in regards to medications? What medications are they taking and why? Is there any family history of any health disease or mental health are really important things to talk about with your child.
Are you surprised by how many college students don't know some basic info about their own health, even something as important as their allergies or medication?
I'm not surprised. And the reason why, as a parent myself, I'm worried about making sure my child wears a helmet, making sure my child doesn't talk to strangers. Well, even when they turn 18, you're worried about all of the safety things, but often we forget about what can my child do if they were to face a health crisis. And so sometimes, unfortunately, although parents are trying to do the best for their kids, they forget about the health history. What have you been doing for your child that they may not know when it comes to their health? And that's why this conversation is so important.
And there's definitely some conversations that kids may not want to have or don't feel comfortable having with their parents. So what information should every young adult be able to tell their doctor without having to call their parents first?
The first thing is know what medications are you allergic to. That is key. The other thing is if you are taking medications, as a doctor, I'm going to ask, why are you taking this medication? How long have you been taking it? That information can be really critical, especially during emergencies. And the other thing is if you do have an emergency, who do you want us to call? Those are three things every college age kid needs to know.
Dr. Bayo, mental health has become a big issue, and luckily there's more transparency, people having honest conversations about it on college campuses. What do parents and their kids need to know about getting help and the available resources?
Often, most campuses have a health center or a mental health center on campus, and they're normally free or have a sliding scale. The other thing is you can identify or locate a psychiatrist or a therapist near your child's college campus. That way, if they were to face a mental health crisis or just need a change in their medications, they know where to go. And the other thing is so important is have your child practice calling and making their own appointment, because as parents, we make those appointments for them, right? But as they go off to college, they need to be able to make those appointments themselves. So if they face a health crisis, that sets them up for success.
It is part of the overall conversation about independence. As you go off to school, you do whatever you can, certainly as a parent. Dr. Bayo, Winchell, thank you so much for your time today.